Hi, I'm Tony Miniaci. I'm from the Cleveland Clinic in Cleveland, Ohio. And today we're going to do an arthroscopic-assisted medial compartment knee resurfacing from Arthrosurface. Let's turn around and go to the specimen, and I'll show you how we get set up. I like to do these patients, so we're going to do the tibia all arthroscopically, and then we'll convert to a mini open procedure for doing the femur. So I just want to show you an incision for today's purposes. We're making the femoral incision a little bit longer. But normally what I like to do is start at the midpoint of the patella and go to about half to 1 centimeter distal to the joint line, just adjacent to the patellar tendon, so that I usually make that incision. I don't make the arthrotomy to start with. Now, as you can see here, we've already inserted one of our tibial screws, which is going to stay in place and helps us in the implantation of our tibial implant. But I'm just going to go to the arthroscopic portion. We'll go through the steps as to how we insert this screw. So that can we go to the arthroscopic portion of the procedure, please? So I like to sit with your arthroscopy. We do a full arthroscopy to start with and make sure that we identify the pathology. And you can see here we have medial compartment changes, anteromedial in the weight-bearing portion of the knee joint. And I like to put the knee, if you can go to an outside shot, just so they can see, in about 20 or 30 degrees of extension. And with some valgus on it, I usually use a post so that you can go back to the scope picture. So once we have this position, can you go back to then we identify our tibial defect. And for this purposes, you see that we have a tibial defect just off the eminence there in the anteromedial tibia in the weight-bearing portion of the tibia. So that our first step is actually centering our insertion device over top. So this is where our tibial implant is going to sit. Now, you can see that there's some marks on this. It's very important that you pay attention to the edges of the tibia, both anteriorly and medially, because each one of those marks is about 2 millimeters. So that we want to be at least 5 millimeters from the edge of the bone so we have a nice circumferential area. So what we do is we put our implant, we make sure that we can sit it properly on the bone so it sits flush, and then through our hole what we're going to do is insert a drill. So this is just like doing an ACL reconstruction, and a drill will go up through the hole into the center of the device. Just to plug the water a little bit so they can see. Okay, so now our drill's been drilled. What I do at this point is I take this implant out, and then we drill over top of it with a 6.5 millimeter drill to make our entry hole. So once we've made our entry hole, what we have to do is we have to determine the depth that we need to make our hole for our tibial implant, so that we have a special device which allows us to put the screw into a certain depth, and we can mark it. So that if you look inside here, I'm going to show that the implant that goes up, this device needs to sit right at the level that you want your implant to sit. So it's not above the joint. You want to sit just at, or if anything, just a little bit below the joint surface, because you can always make this up with the cementing. So that what we do is we then turn the screw over, so that I'm going to show you what this setup looks like on the outside here, so that you can see how the screw and everything all lines up. Just hold the scope here for me for a second. So just, can you unlock that? So this is the construct that we need to put into the tibia. And you can see here, right here in this little fenestration, there's a line that lines up. And once that line is lined up with the screwdriver, you can see that the depth here of the rod that we put in, the depth gauge that we put in, and this is where the top of the joint is going to be, there's an area here that's cut, and that's the width of the tibial implant that we're going to put in. So that once this screw is set in place and it sits into the joint, then we know the depth of the screw we're going to cut. So now all that's left to do is to put in our cutting device, and we're going to cut a slot for our tibial implant. So I just want to show you here, this is our blade that we're going to put into the knee joint. You see that it has a slot in the middle, and when we put it in arthroscopically, you can see that there's a little universal joint in the center. And just hold the scope here for a second so I can show the idea. So that this is going to get connected in the joint, and what we do is we put the rod up and we put it through, and then what we do is we connect it so that our universal joint catches, and then we pull back and it cuts in a retrograde manner. So let's get that portion done. You got it? Mm-hmm. Thank you. So the first thing we do, can we switch back to the arthroscopic portion of the picture? So we insert our blade, and you see you want to center it over the hole that we have. So you can see that we come up into our blade, we turn it back, and then we just catch it in the center of the teeth there, so that if you can see right in there, we've now caught our drive shaft and our blade. So that now we're ready to cut. Now, if you go to the outside picture again, so we can show you what happens here. So now we need to lock our blade into position so that we have a locking mechanism that slides up through the screw, and we have a device here that catches it and locks it, so that now when we drill, we can cut backwards and the whole device is locked. And you can see it's calibrated off of a spring mechanism. So go back to the scope portion. So now that we're locked, we can safely let our blade go. And what I do is unlock it and then pull the device out. And so you can see we now have a construct in the knee joint that allows us to cut. So just, we're going to get our drill set up here. The beautiful thing about this blade is that it's set up so that even though it may abrade the meniscus, that it's not going to necessarily cut it. So that I'm going to go reverse just to get the thing centered, get some of the articular cartilage that may be around off. And once we're started, then what I do is I just go in an anterior position, and then I want to just pull in line. Back towards myself, and it starts to cut. And you can hear it just starting to cut the bone there. I'll show you there. You can see it's just starting to cut a slot. And what I like to do is just go back and forth, and this will cut right to the bottom of the screw. And I'll show you in there. You see, I get right to the screw, and now it's cut. So there, our slot for our tibial implant is cut. And you can see it's a nice round circle. It's oblique, obviously, because we're coming up at an oblique angle. And so once we've cut our slot, now we need to measure to make sure that the template fits properly and we have no problems. So that, let's take this off, please. So we're going to leave our guide in position so that we can just test to make sure that we don't need to readjust, go up or down anymore. So that you see we're looking at our slot, and you can see that it actually resurfaces a fair amount of the tibia. So that this is now our trial guide, and this is a little bit thinner than the regular one, but the thickness of this and the thickness of the blade makes up for the thickness of a real implant. So you see we insert it into position, and we can see that it sits down nice and flush at the back there, and it's actually fairly congruent fit all the way around. All right. So that's good. So I'm happy with the height and position of that implant. So I'm just going to accept that one, and that's going to be the final one. So now at this point in time, I'm just going to clean up my joint surfaces, make sure I clean out any debris from the knee joint that may be left. Can I have a shaver, please? So, foot pedal. Suction. So I just want to clean off any debris, make sure that there's nothing that's going to prevent the implant from going down into position. So I just want to clean off the edges of my hole there. You can see the meniscus just a little bit frayed, but it's still intact, and the whole purpose of this procedure is to be meniscus sparing, so that you don't want to take any of that down at this point in time. Now, it's up to you if you want to change, if you want to put the final implant in now or not. I'm just going to show it to you so that you can understand the technique, and then we'll go to the femoral side. So what we do to put the final implant in, can you just hold the scope? So if you give me a sort of a half outside, half inside picture, we have to take the blade off and disassemble it again. So that, can I have the arthroscopic picture up there again as well, please? So you see we've turned the blade. Now you got to show me the back a little bit so I can see. Okay, so what we want to do is we want to grab the blade right in line with the slot. All right? Then on the outside, you can see I'm pinching the device. I'm disassembling the locking mechanism. And what I do is I unhook it in the joint, take the shaft out, pull the blade out of the joint. So now we've disassembled our mechanism, and we've cut our slot for our tibial implant. So you can see there's our slot for our final tibial implant to go into position. So now it's basically some just simple arthroscopic techniques, what we use. You see the screw is still in position. we're going to leave that in place, and we're going to cement this at the end of the procedure, but we're not going to do it now. So that what I do now is just hold the scope here, please, and just give us an inside-outside view. So that here you can see we have a nitinol wire that we're going to thread up through our screw. And can you give me an arthroscopy and an outside picture so I can show? So we're going to thread this nitinol wire through the screw into the joint. I'm going to grab it from the joint. All right, so that now I have the wire on the outside. And then what we do is we have a fiber wire suture, or whatever suture you please, on the back of the implanting device. We grab the suture tails. Okay, just let go. We pull it out through the screw threads. And then what we do is we implant this into the knee joint. And there you see our final implantation position for our tibial implant. Okay, and I'm pulling on that with the sutures. You see, that's actually, these sutures here are going to help me when I pressurize the cement at the end. What I use is the implant as a cap. We have a fixed hole here that we're going to put a plastic one of these inserts into the tibial hole. And what that allows us to do is pressurize the cement around the tibial implant. So at this point, we're done our tibial implant except for fixation. Do you want to show the cementing now? We don't do that. Yeah, we don't cement this right at this position now, but I'm just going to show you how I take everything out so that it's all done and you don't have to worry about it. So what I do is I take the screw out, take the metal screw, just pull on those sutures, please. Thank you. And so I just re-thread them back through the screw so that we keep on line. Okay. And then what we have is we have a plastic cannulated portion. Could you just hold the scope, please? So you can go to the all outside shot at this point. So you see I have this device here which is also threaded. I don't know if you can see the threads. And what we do is we actually slide that up the sutures. We find the hole, and this gets turned up the hole. You want to cement now? No, I don't want to cement now. I just want to show the technique. And so we turn that up the hole, and you see, so we have a closed system here. Cement now can only go in the hole, and by pulling traction on the suture, we actually have a pressurized system to cement. Now, just let me show you on the inside portion again. Actually, we could probably cement now. As you see, we have this. It's on power. Cement is in here, and by power, we can extrude the cement under significant pressure. And so that by putting it up through this area here, holding this device, and putting the cement up in, and somebody pulling on the suture, can you just grab the suture? What we do is we have a pressurized system into the joint now. And you can see the cement starts to extrude itself out the hole. And if you look inside the joint. So what I do is it's sort of a three-step technique. What I do is I put some in, hold the cap down, and then I put a little more in to allow the cap to come up, and I pull it down again, and then I put a little bit more cement in, just let it sit for a while, and then I just basically take this plastic device out of here. So rather than we only have a fixed time here to show you, I think we're going to go to the femoral side at this point in time and leave the tibia at this point, okay? So for demonstration purposes, because you can do this through a smaller incision, but for demo purposes today, I'm just going to make the incision a little bit longer, but usually it comes from about the mid-pole of the patella down to about 5 to 10 millimeters past the joint line, and that's what you need to see. So I take the patellar tendon, and we don't dislocate the patella, you don't cut the quads mechanism, and at this point we can turn off the water, suck it dry, and take our scope out of the joint. So we can go to the all outside picture at this point. Now, everybody has their own special retractors. All you need is something in the intercondylar notch to put beside the PCL to hold the patella out of the way. So what we need to do is just get, can you put another one up in here, Mike, so we can show. It's nice to have lots of hands to help, but just so you guys can see. So there's the femoral condyle. And what we have here, this instrument here, if you see the device, it has two free arms. There's an AP and a medial lateral direction. And what they do is by touching all of these to the femoral condyle, what it allows, you see they move independently? So what it allows is for you to get perpendicular both in the AP and in the medial lateral plane. So what you want to do is you want to actually put this implant right on the axis of rotation of the cam of the medial femoral condyle, so that you got to make sure it's not perpendicular to the leg. You want to make sure that it actually follows the contour of the joint surface, and you want all 4 points to be touching. So we put it down. We're happy with the position from medial lateral, and you can see it's touching at the top, and I can see that it's touching at the back here, so that we're happy with that implant. So once we're happy in that position, what we do is we put a guide wire and we insert it straight down. And these guide wires are all laser marked and etched, because all the depth cuts are going to be based off of these laser marks as we put them in. So that's our first pin, and that is probably the most important pin in terms of getting things started. So yeah, I'm moving along here. So here is a device, and what this is going to do is it's going to set the height. There's a laser mark on the edge here, and you want this to go to the level of the articular cartilage or the joint line where it used to be. So you can, what I like to do is I like to turn it down to a level, and that's just at the level of the articular cartilage as it was before. Now, check key, please. So once you've got that in position, now we need to take our measurements of the curvatures that we're trying to reconstruct. So that this is a 20 millimeter device, so that's the width of the implant. And we're going to go medial, and that shows us it's a 3. And lateral, which shows us it's a 3. So that the implant that we're going to use is a 3 millimeter implant in terms of curvature from medial to lateral. Now this device is a 40 millimeter device, and it's going to measure the AP length. So what I like to do is first flex the knee up, make it touch at the bottom. Can you see that number? So we have a 7. And a 7, so that we have a 7 curvature, and the 7 curvature is from anterior to posterior. So that what we've measured here, and you have a card, and you have the number of implants. So we have 10 different implants and a card, and it tells you once you have all your numbers in place that we're going to need a 7x3 implant, and that's taken there, and then that's how you base the rest of your reamers off of it. So that you can see there's the card that comes with each set, and there's the setup. So that we've got everything in place still, so that the next thing we do is we've got to drill our central reamer. And this is going to take away about 2 to 3 millimeters of bone, subchondral bone, for the implantation. So you can see that there's very minimal bone resection. And the good thing about this is that if you ever have to revise this to a total or to a unicompartmental, or to be honest with you, even if you wanted to do a massive allograft procedure, in this case, you can still revise it because we take away very little bone. Now, the beauty of this system is that it's calibrated so that you can see it cuts, and it will stop cutting as soon as it hits the screw below it. So that everything is calibrated. And what I like to do is sort of take it. You see, you can hear the pitch change. It won't go any further. We've cut it, and you can actually sort of feel around it and say, yeah, that's the level that it wants to be at. That's where my new joint is going to be. So that once we're happy there, we take it out, and you can see the central hole is reamed. I don't know if you can get a nice picture on that. And then what we do is we then remove the centering shaft that we had in there from before. And this comes out. I use the handle so we don't screw up the pins. We don't get off axis. We know where we are with everything, because I want to leave this pin in, and I want to take this centering shaft off, because now what we have to do is ream top and bottom to get the curvatures of the implant in the top and in the bottom situation. So what we do is we take this out. We have a second device here, and these are all calibrated. So this is a 7 curvature that we're going to put in here. And again, this is independent. So this is going to go in the circle, and this is going to go on the 2 tips of the femoral condyle to insert our next 2 pins that are going to allow us to ream in an anterior posterior. Oh, sorry, let me put this. So, Steve, can you just grab that one? Yeah. So we're going to go in that position there. Make sure it's seated properly. We have these 2 pins, and these should go symmetrically around the circle. And what we're going to do is insert the bottom pin. Again, these are all cannulated and calibrated with laser marks. Chuck keep. And enter. Chuck keep. All right, and so that's the position. Now, what you want to do is once you're in position there, you remove the 2 yellow pins from the bottom, from the top. You remove the central device, and if you've done everything properly, you can see that these are all parallel. So if you're parallel, you know that you've got the pins in the appropriate position. The second check is that you look and you see the bottom pin and the top pin are right at the levels of the hole, so that what we know is that it's pretty symmetrical around there, so that our reamings are going to be good. So what we're going to do is we're going to take out our central pin now. And so now what we're going to do is ream for our bottom and our top portions of the implant. So this is a 3 implant. What I want to show you, this device has a hole in it right here, and it gives you a strobe effect with the pin as it comes up, and it'll stop the implant from, stop the reamer from going any further down. So I might just pull that down. So we just start that off the bone, and we come down again. You can sort of feel it, a very soft bone, so you have to be careful. Now we move to the top wire, and we got to do the same thing. It's the same drill because it's a symmetrical medial lateral. And so that, again, we look through the fenestration of the window. And you can see the wire coming up in the hole. And there you can see, there it is. It's met now. The wire's all the way through. I think you can see that on the screen, okay? So now we've taken that out. Can we just wash this out a little bit, get some fluid or something? So I'm just going to clean some of this debris. All right, so now we're ready for our trial implant. So that the trial, you can see here, is a little bit asymmetrical, so that the posterior portion, which is the flange, is right here. That's because as you get a little bit further back, the cartilage and everything gets a little bit thicker back there, so we make the posterior flange a little thicker to match the anatomy of the patient. You have your wires in there to set up your alignment, and then what we do is you can see we put it in position, and you can see that we have a pretty good fit from an anatomical standpoint. So once we get our fit, what we do is we put this drill down the center, and this point here is the critical point because you can always change the position of this implant up until now. So once you put this in, it's down to the laser mark. Chuck key, please. Now you're set in terms of the axial alignment of your femoral implant. Okay? So we have that. We take our pin. This is our pin, and we want to make sure that we maintain this axis, and we want to tap it back in. And then what we do is we take this out, leave the drill in place, and now what we're doing is we're going to cut a slot to start our screw hole, and then what we're going to do is we're going to tap it so that this is just a step reamer. It comes down over top of the centering shaft, and it also has a window in it down here that tells you the depth that it needs to go to. So we're down now, and then what we're going to do is, again, over the drill, is use a tap, and this cuts the threads for our screw device. And so we're going to tap this, and once we see the end of the drill come to the end of the tap, and it's just coming up now. I don't know if you can see here. Can you guys see it? Well, the screw, the tap and the drill are symmetrical here. They're flush. I don't know. I think you can see it just barely there. And now you know that you've tapped deep enough for the screw. You take it all out. You're always checking your alignment to make sure that everything is in line. That gets your screw in the right position. So what we do is we take all this out. And the next thing we do is we're going to put our screw into position, take our drill out. Now, the screw, what we do is initially we just set it in here so we can get it in the appropriate line. And then we have a way of tightening it down to the appropriate depth, because it's important to know the depth of the screw because that sets the height of the implant. Okay? So we just screw this whole assembly together to set the screw, make sure everything's in the right position. And you can see, so it's nice and tight. You can see our implant still fits very nice anatomically. This screwdriver here, you can see it's a screwdriver, and at the bottom end here has a little shoulder. Once the shoulder touches this device, that's the depth of the screw that you need to set. So what I do is we set it all up. We go down, we engage the screw, and we turn it in. And this is not a hard tightening. As soon as that edge touches there, that's it. The screw thread is set, and you don't need to turn it anymore. So now we have that. Our screw is in. You can see that our alignment is still pretty good. You can see the screw and everything is all in place. So at this point, we can remove all of our wires. We're ready to go with our femoral guide. You see we have an inserting device that holds onto the implant so that that holds it so that you can put it in place. You line it up with the finger. You need to put some cement on the back side of this. Once you have it engaged on the screw, you leave it in position like that, and then what you do is you take your hammering device, and this just taps it down until you get it flush, and you can see that we've got an anatomic fit there on the femoral condyle. So at this point, we take our instruments out. Now at this point, I know that we talked about cementing. This is when I would cement it. Let me just show you arthroscopically what we've got. So here's our final product. Implant now cemented in position, held down, and there's our femoral implant there. And you can see that throughout. Now I would clean all this debris out, obviously, but there you go. There's 90 degrees of flexion. You see there's still contact with the implant, and then past 90 degrees, the posterior femoral condyle comes in play. But you see the meniscus and everything roll forward, and with the meniscus and everything left in place. So I would clean up all this debris now, and I think you get the idea of how that implant's in place. Okay? Thank you very much.